Good evening, friends. Dr. Rushabh Shah here. I am an eye surgeon and a specialist in squints and pediatric ophthalmology. So आज हम एक कॉमन टॉपिक के बारे में डिस्कस करते हैं जो कि स्क्विंट, खास करके बच्चों में स्क्विंट ज़्यादा कॉमन है. तो स्क्विंट, व्हाट इज द डेफिनेशन ऑफ स्क्विंट? ये क्या, इज इट अ कॉस्मेटिक प्रॉब्लम या इट्स अ फंक्शनल वन? So let's discuss in detail. So squint by definition means it's a misalignment of the eyes. That means the normal alignment between the two eyes is lost. Either one eye goes outward, exotropia, or inward, esotropia, upward, hypertropia, downward, hypotropia. It can also be sometimes torsional, that means encyclotorsion or excyclotorsional. There are 7 muscles which surround the eyeball. Their job is to help move the eyeball in different directions. So as a squint surgeon, we deal with these muscles. We weaken one and tighten the other so as to align the eyes. What is the prevalence of squint? Squint affects around 2 to 4% of children. And earlier we treat a squint, the better is the prognosis and the improvement in a child's life. Classification of squints are mainly classified into paralytic and non-paralytic. Paralytic means there are 3, 4 and 6 cranial nerves which supply the extraocular muscles. Now if there is a paralytic attack there, like a stroke, then that leads to something called as a paralytic squint. And a non-paralytic squint, the difference is that it is a comitant squint. That means the angle of squint remains the same in all directions of gaze. Often double vision is seen in a paralytic squint. What are the consequences of a squint? First of all, we should know that squint is not a cosmetic problem, it is a functional one. Now when one eye squints, that means the other eye, which is the good eye, is doing all the work, and the squinted eye tends to lag behind, it then become lazy and amblyopic. The binocular single vision, that is the ability to be able to use both eyes together, is lost when one eye squints, and because of that it leads to a loss of depth perception or stereopsis, what we call in a common language as the 3D vision. So you remember the theaters, we go for 3D movies, we put on those 3D glasses and see 3D. A squint child will never be able to see 3D because he uses only one eye at a time. It gives him a 2D vision. Because of that, if you use only one eye, even the field of view is restricted. And not to mention the numerous psychosocial effects that come with squinting, like teasing by the peers in school and college, the significant impact it has on the self-confidence of a person who suffers from squint all his life. So that's why the importance of detecting and treating a squint earlier. Now coming to the treatment modality. Now not all squints need surgery. First decide what type of squint it is. There are certain squints, by just giving the correction of the glasses, the squint gets improved, what we call an accommodative esotropia. Now the child suffers from a high number which is responsible for giving him the squint. You give him glasses and the squint is corrected. Sometimes after giving the glasses the squint improves, but there is some amount of squint which remains still, and this has to be tackled with intervention in the form of surgery, what we call as a partially accommodative squint. And then we have certain non-accommodative kind of squints where the refractive error has got nothing to do with the squint and the squint is there regardless of the refractive error, what we call as non-accommodative squints. The congenital esotropia, the squint that comes from birth, is one of them. So this was about esotropias. Then we have exotropias. Exotropias meaning outward squints, wherein it may be intermittent or it may be constant. Now if the squint is persisting for long, if it is present more than 50 times a day, if it is causing asthenopic symptoms, then yes, it has to be addressed and treated as early as 3.5 to 4 years of age. So the various treatment modalities which we have are, first and foremost, we correct the refractive error. Please correct the vision first, followed by improving the amblyopia. Either you patch the good eye or occlude it or do a penalization. Certain kind of squint like acute onset squints or congenital squints need surgery immediately. We have another modality called as Botox, wherein it's an injection. It's an anticholinesterase receptor antagonist where it causes blockage at the neuromuscular junction and causes a paralysis of the muscle. It is useful in certain squints like acute onset squints or paralytic squints. And we have the dichoptic therapy, wherein we make the child to see softwares, certain play games on the computer, and we try to improve the alignment also with that. So friends, just concluding, squint is a medical condition which needs to be intervened early. The earlier you treat a child, the better is the improvement and prognosis for the child, and the results are extremely good. They are more than 95% success rate for the squint surgery. It is done as a daycare procedure. Thank you.